Hi friends, welcome to the channel. Today we are going to discuss a very important topic from community health nursing subject, that is a primary health care. Primary health care means the basic care that is to be provided to the individual, society or the community. Okay, today we are going to see from where this term primary health care came, what is the definition, what are the elements and what are the principles of the primary health care. So welcome to the Nursing Star video channel. If you are new to this channel, please like, share and subscribe this channel. So let's start. Primary healthcare. Primary healthcare means what? It is a basic care. Now from where this term primary healthcare came? In 1978, a new approach to the healthcare came into existence international conference at Alma Ata, USSR. There was an international conference in 1978 held by the WHO in USSR, means present days Russia. In that, the Alma Ata Declaration given the term primary healthcare that should be implemented into every country. So, what is the definition of the primary healthcare given by the Alma Ata Declaration? The definition is primary healthcare is the essential healthcare made universally accessible to the individual and acceptable to the them through the full participation and at the cost the community and the country can afford. There are four major terms in this definition, that is accessible, acceptable, full participation and afford, means affordable. So primary healthcare मतलब क्या है? It is essential healthcare. It is a essential healthcare. It should be made universally accessible, means it should be available to everybody. Okay, then the second is what? To the individual and acceptable to them. It should be acceptable to them through what? Through full participation. The healthcare, that primary healthcare should include full participation of the individual and the society. And the fourth term is what? At the cost the community and country can afford, means it should be affordable, it should have the minimum cost. Okay, it should be affordable to the community as well as the country. Okay, this term primary healthcare was accepted by all the countries as the key. It is the chabi. It is a chabi for what? It is the key to attainment of the health for all by 2000 AD. Okay, at that time in 1978 the term primary health care was initiated, was coined, and it was going to be implemented for what? For the attainment of the health for all by 2000 AD. Okay, now we will see what are the eight essential components. The essential eight components of the primary healthcare is as follows. The first is education concerning prevailing health problems and methods of preventing and controlling them. Means what? Educating the individual and community. इंडिविजुअल को, कम्युनिटी को क्या करना है? एजुकेट करना है. For what? For the method of preventing and controlling the diseases, health problems. Okay. Second is a promotion of the food supply and proper nutrition. Means promote करना है किसके लिए? Food supply and proper nutrition के लिए. Third is an adequate supply of safe water and basic sanitation. Means to provide adequate supply of water, safe water and basic sanitation. Fourth is maternal and child health care including family planning. Maternal and child health care. Maternal health includes antenatal, intranatal and also the postnatal. And child health care includes the care given in the neonate, infant stage and also in the child stage. Okay, it should include the family planning. Family planning services like temporary services, temporary methods of the family planning, permanent methods of the family planning. Fifth is the immunization against major infectious disease. The immunization services must be there for mothers, for the children and other high risk or vulnerable people or the communities. Then Sixth is the prevention and control of locally endemic disease. There are locally endemic disease. कुछ कुछ डिसीज होते हैं वही एरियाज में रहते हैं, उसको क्या कहते हैं, लोकली एंडेमिक डिसीजेस. सो देर मस्ट बी द स्ट्रैटेजीज फॉर प्रिवेंशन एंड कंट्रोल ऑफ लोकली एंडेमिक डिसीजेस. Seventh is the appropriate treatment of common diseases and injuries. Primary healthcare should include what? The appropriate treatment. It should not be vague. कैसे भी नहीं होना चाहिए. It should be appropriate treatment of common diseases and injuries. And the last eighth essential component is what? Provision of essential drugs. प्राइमरी हेल्थ केयर का क्या है मेन एसेंशियल कंपोनेंट, कि जो एसेंशियल ड्रग्स है उसका वो प्रोवाइड होना चाहिए. द प्रोविजन ऑफ एसेंशियल ड्रग्स टू द हेल्थ सेंटर्स. ओके, these are the 8 essential component of primary health care. It should be followed. Now we will see what are the principles of the PHC. There are 5 principles of the primary health care. PHC means primary health care. First is the equitable distribution. Equitable distribution means what? Healthcare services should be shared equally by all the people, irrespective of their ability to pay and all. Means उसका एबिलिटी है पे करने के लिए या नहीं है, पर उसको मिलना चाहिए. बट उसको जो सर्विसेज है, बेसिक सर्विसेज है, प्राइमरी सर्विसेज है, उसको प्रोवाइड होना ही चाहिए. ओके, with of their ability to pay and all, rich or poor, urban or rural. अगर वो रिच है या पुअर है, अर्बन एरिया में रहता है या रूरल एरिया में रहता है, पर उसको ये प्राइमरी हेल्थ केयर मिलनी ही चाहिए. It must have the access to the health care. Now the term is equitable, not equal. Okay, equitable मतलब क्या है? फॉर एग्जाम्पल अर्बन और रूरल का लेंगे अपन. इन अर्बन एरियाज देर आर मोर हॉस्पिटल्स, मोर हेल्थ क्लिनिक्स. इन कंपैरिजन टू दैट इन रूरल एरियाज देर आर लेस क्लिनिक्स एंड लेस हॉस्पिटल्स. सो द मोर नेसेसिटी इज इन रूरल एरियाज. सो इट्स द गवर्नमेंट responsibility that to provide the more services and make the balance between the communities or the areas. Okay. Now the second principle is community participation. Community participation. What is community participation? There must be continuous efforts to secure meaningful involvement of the community in planning, implementation and maintenance of the healthcare services. Okay, there should be the community participation. Means what? There should be the feeling of we-ness. Okay, togetherness. Okay, besides maximum reliance on the local resources. कम्युनिटी का पार्टिसिपेशन लेना है और दे शुड बी reliance on the local resources such as manpower, money and material. Okay, this is a community participation. Third principle क्या है? Third principle is a intersectoral coordination. Primary health care cannot be provided by the healthcare sector alone. सिर्फ हेल्थ सेक्टर प्राइमरी हेल्थ केयर सर्विसेज प्रोवाइड नहीं कर सकता, उसके लिए अदर सेक्टर्स की भी मदद या ज़रूरत होती है. ऑल रिलेटेड sectors and aspects of the national and community should be included in the process, like agriculture, animal husbandry, food industry, education, housing, public work, communication and other sectors. ये सारे सेक्टर्स है, ये इनका यूनाइटेड एफर्ट्स रहना चाहिए प्राइमरी हेल्थ केयर को डिलीवर्ड करने के लिए. इसको क्या कहते हैं? इंटरसेक्टरल कोऑर्डिनेशन. अकेला हेल्थ केयर सेक्टर सब काम नहीं कर सकता, इसके लिए अलग अलग डिपार्टमेंट्स जो गवर्नमेंट है, नॉन गवर्नमेंट है, उसका भी हेल्प लगता है. ओके, दे आर नीडेड. नाउ द फोर्थ इज एप्रोप्रिएट टेक्नोलॉजी. इट इज डिफाइंड एज अ टेक्नोलॉजी दैट इज साइंटिफिकली साउंड, adaptable to the local needs and acceptable to those who apply it and for whom it is used. ऐसी टेक्नोलॉजी बनानी है, ऐसी सर्विसेज बनानी है जो साइंटिफिकली साउंड हो, एडेप्टेबल हो लोकल कंडीशंस को, लोकल नीड्स को, एंड इट शुड बी एक्सेप्टेबल टू द वन हु यूज्ड and on whom it is to be used. Okay, ये होना चाहिए, it is used, and that can be maintained by the people themselves should be maintaining the technology. वो खुद से वो मेंटेन कर सके इन कीपिंग विद द प्रिंसिपल टू द सेल्फ रिलायंस. इसके वजह से क्या होगा, वो सेल्फ रिलायंट होंगे. जो कम्युनिटी है वो सेल्फ रिलायंट होगा. हमारे पीपल की खुद के पीपल की केयर कर सके. ओके, दिस इज द अप्रोप्रिएट टेक्नोलॉजी. और ये टेक्नोलॉजी कैसे होनी चाहिए, इट शुड बी अफोर्डेबल टू द कम्युनिटी एंड द कंट्री. नाउ द लास्ट फिफ्थ is the manpower development. Manpower development क्या है? The mobilization of the health services, the qualified and the adequate manpower is required. It plays a very important role in the outcome of the healthcare services. Manpower development करना है. प्राइमरी हेल्थ केयर में क्या करना है, मैन पावर डेवलपमेंट करना है. और वो मैन पावर किधर से चाहिए, इट शुड बी लोकल, इट शुड बी क्वालिफाइड. वो कैसा होना चाहिए, क्वालिफाइड होना चाहिए. एंड इट शुड बी एडिक्वेट. It should be local, it should be qualified and it should be adequate for the healthcare services. इसके वजह से आशा ये पोस्ट तैयार किया है. It is local. There is a training given to the ASHA to make her qualify, and it is given adequate manpower is maintained. Means what? ASHA is given only 1000 houses to be surveyed or services to be provided. Okay, this type of manpower development is done by the primary health care. Okay, these are the 5 principles of the primary health care. So how was the video? Today we have seen from where the primary health care center or primary health care, the term was coined, what is the definition, what are the 8 components or the elements of the primary health care, and what are the principles of the primary health care.